Hi everyone, welcome to our Meditation Museum online specials. I'm Sister Jenna, and on a daily basis between 6:30 and 7:30 EST, we get a chance to be with you in your homes and to check up on you and see how you're doing since the meditation museums are closed because of the coronavirus pandemic. There's a lot happening, and this morning when I woke up for meditation, I began to think a lot about our doctors, nurses, healthcare providers, even the administrators as well. I was thinking about the janitors, the individuals who are keeping the hospitals clean and sanitized. And I thought about how they must be feeling and what they must be going through and the enormous amount of stress that they must be under. And I thought, why not dedicate today's show just for them, to let them know that we value, appreciate, and thank you for your tireless dedication. Perhaps, prior to all of this going on, the hospital was always quite busy anyway. I've myself taken our Sister Gita to the emergency room more times than I would like to mention. And I remembered how the doctors would always be full, beds would be outside. And I can't imagine now what it must be like. And even if I'm having a little ache or a problem, it's like that can wait. Let's just wait. What's really needed are people who are really in need, that really need to be in that hospital. So, of course, I don't need to say that these are unique times and these are different times. Bloomberg reports said there was over 1.4 billion people that have been requested to stay home. Our population is 7 point something billion. And I'm suspecting we're going to get up to those numbers where individuals are just going to be asked, stay home. There is no cure for this virus. And if we can just stay home and wait until it passes, at least for ourselves. And then again, there's there's a unique sort of catch-22 because we don't know the individuals who might not be very responsible, and we go back to work after 2 weeks. So we go back to work after 3 weeks, and there's somebody in the office who wasn't responsible or who thinks that they're okay, and it turns out that they might be carrying this virus. And death is something that we don't usually like to talk about. And the fact that the United States rate so far is over 500, there are now over 550 reported deaths because of this virus. And testings haven't really taken place yet. I want you to imagine. Think about what our healthcare providers are really enduring right now. Some of them have already gotten sick. Some of them are just plain exhausted. But it's their commitment, and it's their love, and it's their oath. So I'd like to just play a little video called Light of the World, thinking about them in mind, in which, they go out there and they give their light to everyone, and then when they come home, they might be exhausted. And as much as they come home to the kids, a wife or a spouse or roommates or a partner who they love, or maybe even to a quiet home, sometimes it serves the soul just a little. But when that particular soul can connect to the source, then it can serve the soul a lot. It's one of my favorite animated videos. Enjoy. Sorry, was I on mute? Sorry about that. I just wanted to share with you why I thought that video was so cute and lovely and perfect for you. It's that it talks about really bringing your light back to bring your shine. You leave your home and you go to the hospitals or the clinics and you give so much of your time and energy to so many lives. I know the death rate in the United States right now is over 500 cases. Over 500 cases. And the testing hasn't really taken place yet. And over 500 souls have left their bodies. And we can only imagine how you must be feeling going into work, not having enough surgical masks, not having enough ventilators, looking at your colleagues and your nurses and the janitors and the scrubbers and the nurse and just the administrators and everyone just exhausted, not having enough beds for your patients that you want to be responsible in healing and taking care of. But who takes care of you? Who heals you? Who looks out for you? Today's about that. Today's simply for you. If you happen to get a moment to just pause during this broadcast, could you? Could you call some of your other colleagues at work or at home if you happen to have gone home a little bit early? Just take a moment. Just take a breath. Breathe. Take another breath. And another breath. And I'd like you to imagine that all of our pure wishes and good feelings are surrounding you, whatever hospital you're in, whatever clinic you might be in, whatever ship you're in, if you're sailing over to Los Angeles or to New York. Maybe you've gone home for rest and refreshment. Maybe you're concerned about infecting your family or a friend. Forget all of that right now. Just feel that there are many of us holding you in sacred protection. And looking over you. And valuing you for your commitment, your oath, your tirelessness. I think so many of us wish that we could be there to help you in physical ways, to make it easier on you. And I hope that our pure wishes and blessings at least help a little bit. We really do. Since this exile, so to speak, so many thoughts have emerged, ideas, creativity, next best step. Most importantly is our personal empowerment and what we need to do to take care of the well-being of our minds. Maybe many of the cases that are coming to the physicians are really anxiety cases. It's spring. It's allergy season. Doesn't make it any better, doesn't it? And the irony about this time is that the weather is really going to be even more beautiful, and we can't go outside. It's as if Mother Nature is saying, just take a break. Can you just give me just a little break and stay home and do some introspection and some inner work, and try to understand if there is something that you've done that has been giving your mind sorrow or pain or frustration, and have you been peaceless with the cells in your body? Have you been peaceless with another person? This time of exile and quietude is offering us a very good chance to not only heal ourselves, but to be healers for one another. And where you have doctors and physicians who are out there taking care of our physical bodies, we're still responsible for taking care of our minds. It's our mind that is really the powerhouse. We can think ourselves to healing, or we can think ourselves into ill health. It's always just a thought away. Everything is just a thought away. I came across a doctor in Canada, and he was quite emphatic and very sincere about what he was enduring on the front lines and how severe this period was, and that he's never seen anything like this. And I wanted to show you his video because I thought it spoke volumes for us to understand what a physician actually feels. So imagine what the nurses are feeling, what the secretaries are feeling, the administrators are feeling, the people at the reception desk, the people that are cleaning up the rooms, the bathroom, scrubbing. Just imagine. And so I really, really want us to keep sending our prayers and good wishes here. So this video, I kind of tried my best to put it together. It's very amateur. But in the beginning of it, it's just some appreciation of love and gratitude with just some images of just inspiring us a little bit. But also you'll hear from the doctor from Canada who will give us a very, very strong message. And then at the end of that, you will hear our love and gratitude and just moments of silence for our healthcare providers. I hope you enjoy it.
Dear friends, brothers and sisters, my name is Dr. Bajwa. I'm an emergency physician working on the front lines in Canada. I'd like to share with you what's happening on the hospital front, something that most people right now are not seeing, and I hope to God they never see. This virus is spreading so fast in the world because it's such a cunning little virus. Most viruses are either spread quickly, like the flu, or they're serious, like SARS. But this one is both. One of the main reasons why it's spreading like fire is because it starts to spread even before you know you have it. I might be spreading the virus right now and not even know it until I get sick tomorrow or the next day. The numbers that you see in the media are not accurate. They show only the people who have been tested that are positive. There are so many more people out there who have it, who are spreading it, and we don't even know about them because they haven't been tested. Canada's doing a pretty good job. We've recently increased our testing in the past few days, but it's going to get a lot worse. The healthcare system, the workers are doing the best we can. I might sound like an alarmist, but I can live with that. In fact, I'll fall over in happiness if I'm wrong. I'm just trying to stress the importance of what public health is trying to tell us. Your actions today will determine what I'm seeing 2 weeks from now. We can handle many sick patients, but there's a limit. After that, well, I'd rather not say. We can get more ventilator machines, but who's going to run them? We only have a limited number of people, and even some of them are going to get sick. We don't have the time to train new ones, so we've already asked retired doctors, nurses, and other healthcare workers to come back from retirement to help us. But even that's not going to be enough. I cannot say it enough. Social distancing, staying home, washing your hands. This is what's going to get us through this tough time. We all have to remember that all of humanity is suffering right now. The virus doesn't care what color your skin is, how much money you have. We're all in this together. We'll pull through this together. The worst thing that could happen is that you did it for nothing. But the odds are that's not true. When you show up at my emergency room door, I promise to do what I can for you. In return, will you promise what you can do for me? Just stay home. Please.
There's nothing more to do than call on you. Love and gratitude. Love and gratitude.
It was so sweet. It was an amateur little snippet I brought together, but I thought that the passion of that physician said it all. And I believe also at the end of this video, or I think as we get closer to our program, I'll also show you the way to wash your hands. There should be a part on the footage that will also offer you a very simple example of the washing of the hands. I used to think I washed my hands pretty well, but then with this kind of description, I realized that there are different areas that you could also miss. And so as we get closer to the end of the show, we'll also show you some of that. There are physical doctors, and there are mental doctors, and there are spiritual doctors. A doctor is a doctor. And I wanted to read you this, which I thought was really important for you to hear Give me 1 second here. It was so beautiful when I read it. It's the doctor's oath. Has anyone ever read that, to hear what a doctor pledges when they actually get their medical degree? And I'm thinking of a few doctors that we actually know, and I've been sending my good wishes to them too, to really, that they're okay and everything is fine, because I think it's really important for us to keep sending them our good wishes. But let me read you what comes up here, which I really like a lot. I'm going to read you the modern version of the Hippocratic Oath. When a physician gets their medical license, they swear to fulfill, to the best of their ability and judgment, this covenant. I will respect the hard-won scientific gains of those physicians in whose steps I walk, and gladly share such knowledge as is mine with those who are to follow. I will apply for the benefit of the sick all measures which are required, avoiding those twin traps of overtreatment and therapeutic nihilism. I'll remember that there is art to medicine as well as science, and that warmth, sympathy, and understanding may outweigh the surgeon's knife or the chemist's drug. I will not be ashamed to say, I know not, nor will I fail to call my colleagues when the skills of another are needed for a patient's recovery. I will respect the privacy of my patients, for their problems are not disclosed to me that the world may know. Most especially must I tread with care in matters of life and death. If it's given to me to save a life, all thanks. But it may also be within my power to take a life. This awesome responsibility must be faced with great humbleness and awareness of my own frailty, and above all, I must not play at God. I'll remember that I do not treat a fever, chart, a cancerous growth, but a sick human being whose illness may affect the person's family and economic stability. My responsibility includes these related problems if I am to care adequately for the sick. I will prevent disease whenever I can, for prevention is preferable to cure. I'll remember that I remain a member of society with special obligations to all my fellow human beings, those sound of mind and body as well as the infirm. If I do not violate this oath, may I enjoy life and art, respected while I live and remembered with affection thereafter. May I always act so as to preserve the finest traditions of my calling, and may I long experience the joy of healing those who seek my help. Mm, mm, mm. What did you feel when you heard that? Wasn't that amazing and powerful? I mean, when you think about the role of a physician and the promise they make and the oath that they carry, that this is how these physicians are feeling, that if they begin to feel helpless in their position and unable to help us, this hurts. So this is why this segment for me, doing this today, was so important, was to let them know that we're there for them. I mean, I'm feeling the emotions of it all because I know what it's like to be of service to human beings. And even though our museums are closed or some of our meditation spaces are closed, and I want them to be open to be able to embrace and be there for our community, this is the best that we could do. I spoke to a physician as well, and he was saying today that it's just nothing like he's ever seen it before, sister. And now we're actually having to do tele meetings, tele checks, I don't know what was the word he told me, but they're basically checking us now over FaceTime. There's just not enough time or energy for the physical connection. And in order to save the physicians, we have to do televisits with our doctors, the nurses. I look at you as the nurturers, the ones that are holding up the patients and the physicians, keeping the families okay. Your heart is of gold, and we thank you for your service, and we thank you for your care. I'm going to reach out and call a friend of ours who's a physician that says that she'd be happy to speak to us today to give us a little bit of an update and just to find out how they're all doing, and if there's any way as well that we could be of service to the community. So I'm hoping that we can get her online today to just give us some updates. Hi, doctor. How are you?
Hello?
Hi, can you hear me?
Yes, sister.
Okay, so we have you on air, and we just finished a meditation for all of you that's out there on the field doing service for our lives. And I was happy when you gave me the chance to give you a call to find out in what way we could be of more help and support to all of you so that we don't overwhelm you in your hospitals and in your doctor's offices and so on. But firstly, before you answer that question, are you okay? Are you getting enough rest?
Yes, sister. Yeah, it's a lot of changes going on, and as you're saying, it's none of this has been seen before,
Right.
and I think we have to take different steps and explore different things to see how we can come out of this.
Mm-hmm.
As you know, I'm a primary care physician. I take patient as a whole. Like, whole care is important for me. And sometimes, like, the tears roll off my eyes seeing what's going on. It's a situation where we have to face. There is no other way. And at the same time, we have to be strong.
Yeah.
And basically, of course, there is a lot of information out there. We are following CDC guidelines.
Yes.
And day to day, we are having changes. And now they're going to close unimportant visits also. There are a lot of changes going on. I just came off of the meeting.
Okay.
So
now, are there any discussions about the well-being of physicians and the healthcare providers? Because from what I have been keeping up with in the news, everything is about you guys just giving to us. But I haven't heard if they've made any attempts to say, well, this is what I need you guys to do so we can have you all okay.
Yes, I mean, they're trying to make it rotation model going on. Mm-hmm. Because everybody needs rest. Otherwise, we will not be able to be in a position where we can make right decisions.
Right.
So, there are rotations where you do have to get some rest. But again, even during that time, it's a lot on physicians. Also on public also to see, like, we have families and...
right.
Do
you get concerned?
Do
you get concerned sometimes going home to your family after being at the hospital all day?
It was never before, but now these days, yes.
It was never before, but now these days, I understand. Now, are you taking measures to keep your distance from your family members just in case? Because from what I've heard about the virus, you can be carrying it and you have no idea you have it until the symptoms actually kick in.
Yes, you can't believe I keep my door closed, and I have my son knocking my door.
Oh.
It's tough times, and we are trying to maintain the distance.
Yes.
And keep us clean. And do whatever we can. That's what everyone is saying. Like, we have to do whatever we can.
Right.
And it is, for me, sister, it's been very important that, I've been to meditation, I've been practicing meditation. That definitely gives me strength. Even then, it shook me a lot, but I'm trying to just get back. And I think I am trying to just do it because our focus on meditation is every thought.
Yes.
Every thought, we should not be wasting it. Because my concern is we are going to be more depressed by the end of this. We have to face this. And by the end of this, if we don't take care of ourselves as a whole, humanity, we are going to be depressed.
Wow.
So, and that's why it becomes very, very important now to know who we are.
Yes.
So this is how I tell my patients also, like, you have a hand, but you are not a hand.
Right.
In the same way, you have a body, but you are not this body. Then question still remains, who are you? Is you are an energy that is moving this body.
Yeah.
This knowledge has helped me tremendously to just focus on what needs to be done at every moment. And that energy expresses itself through thoughts,
Right.
through words, and our actions.
Right. Indeed. Indeed.
Right? So, and we still have control. We still have control on our thoughts. So every thought we make, because we are now stuck home, most of us are stuck home.
Right.
If we don't contribute as humanity, like as human beings, a being in this human body,
it would be very
we are
challenging.
givers.
Yes.
We are givers, and we have to give to the problem, or in some way our contribution. And if we are stuck not giving it, this energy loves to flow, right? So
right.
If we are not flowing and we are not giving, then it could be another type of problem that can seep into, and we have to start working on those things
It's
now.
a different kind of illness. So one of the thoughts that I had is, we've got people who are watching in and listening into you right now. And I'm curious if they had any questions for you. I'm inviting them to please comment that right now and share whatever you'd like by chance. But I love the fact that you speak about the spirit or the soul and that the body is different versus, that we have to pay attention to the energy. And that's something that we don't hear a lot of doctors tell us to do. They don't tell us to pay attention to our thoughts, words, and deeds in order to heal or help ourselves to remain healthy. And I appreciate you doing that, Doc. I really do. And the reason why I'm not mentioning the doctor's name is that she belongs to a very large medical institution and has asked me to keep her anonymous. And so I wanted to respect her privacy. But she's been doing a lot of work in terms of helping individuals to become healthier and a lot more whole. As he says, she was saying that she takes care of the whole person, not just the body or the organ or the head or the arm, but the whole person. Santosh, do we have any questions for the doctor?
I have from Tina.
Tina's asking a question. Hi, Tina. Welcome.
I work at a clinic and live this doctor's pain, and you help me remember to breathe and connect.
Oh, that's so beautiful. Tina just said to you, doctor, that I work at a clinic and I live this doctor's pain, and that she appreciated you sharing what you shared about the thoughts and the words, correct?
And you help me remember to breathe and connect.
And that you helped her to breathe and connect. So thank you for that. Thank you for your sharing. Any other questions?
And also, Sister Jenna, it's going to improve our immunity too. If we are loving, if we are caring, if we are peaceful, that's how our energy is made up of. And we have to entertain and practice. This is a chance to practice this more at being at home, so that our immunity to fight this unseen virus.
Interesting.
It's very, very important.
So you're saying that if we're loving and caring, it builds our immune system. Could you elaborate on that?
Definitely, the hormones, the type of hormones you release into the body change. Stress is never good, and depression is not our original nature. If it was, everybody would love to be depressed, right?
That's true.
So depression is not our originality. We can live with peace and love forever, not with anxiety or depression forever. So these are subtle things we have to understand and start practicing our original qualities, so we get our power back. We are very powerful, and I think these vibrations can help, especially the healthcare providers. As it's a tremendous stress. I can't even mention. I don't have a word to put it. It's a tremendous stress that everyone is going through. Instead of just wasting our thoughts on saying, hey, or what should I do now, or getting bored, let's put our energy into some good thoughts, good plans, and raise this level of thinking and make sure that we are all growing.
Beautiful.
Because everyone has to step up and internally, because this fear, if we don't have knowledge, it's important to have knowledge. Healthcare providers are also facing trouble now because we don't know much about this virus behavior. We are learning it. We are almost getting it, but it's out of our hands. It might get out of our hands. That's why distancing is very important. Very important. I can't stress more on that. And cleaning, washing hands, as you said, everything is important. Still, there is a chance to control this, and as humanity, and I think we should come up, and I really thank you for this opportunity, or whatever you do, Sister Jenna, because there's a lot of knowledge here which everyone needs to get and start implementing. It's a thought away, as you said. I love this.
Well, we appreciate you so much, and we really keep sending our good wishes and blessings your way, that you are protected. So I don't worry about you, but I still want you to, make sure you are taking care of yourself as well. So thank you for your time today. I know how busy you all have been. It's like a lack of sleep. You might not have known this, but earlier on in the show, I read your Hippocratic Oath and I got emotional. Because you just don't become a doctor just because it's a status thing or it makes you money. But you really become a doctor because it's a calling to help, to care. So when patients are coming to you and your hands are tied and you can't touch them, or you can't go too close to them, or you're not sure if they're sick or not, that's not why you signed up to be a physician in the first place. So I really empathize with not only the ethical challenge that you all must be going through, but also the emotional and spiritual questioning that might be happening for many of you as healthcare providers.
Yeah. But again, as I said, we have to face it, and we will. Your blessings always help. Blessings always help for anybody, and it's a plus. And I really appreciate you having this program, sister.
Thank you so much, Doc. You take good care of yourself, okay? Bye-bye.
Thank you.
I was so touched by her story. She has to stay in her room, a physician, with her son outside of the door. That's how much importance they have put to this particular virus that's out there. And we went to DC the other day in the car. We didn't get out. There were people holding hands. There were families together, and they were gathering, and they were on the mall because of the cherry blossoms. And we were saying, what is it? Did I miss a report that it was okay to do this? We can't stress, our friends. Please be careful, and please be mindful, and please keep tuning in to spiritually charge your mind and your heart and your soul to make it as powerful and strong as possible. I know that when things are as new and different as they are now, we are human, beings that don't really care for change, especially when we're not in control of the change. But I've often seen as well that change is always very good for the soul. And physicians are learning something. Government leaders are learning. Religions are learning. People in religious positions of power are learning a lot. They're thinking about their particular path. Men and women who thought they were gods in their countries and leaders of their countries are bowing and beginning to make decisions. What's best for mankind, not what's best for their political party or their government. What's best for my humanity. Children are running around aimlessly, not aware of what's going on. Moms and dads are scared. If mom and dad has to go out to work like the doctor did, and she comes in, she takes a shower, she goes into her room and locks her door, and she cannot play with her child. It's that serious. So for all of the doctors and nurses, every single one of you, and I don't care if it's just one of you that's watching this today, or 1 million of you, we hold you in our hearts. And every day in our morning meditation, we will dedicate a minute of silence for your empowerment and your protection. And I hope you're open to that. We'll play another heartfelt video for you, and I'll see you back shortly.
If I begin my day, whatever time my day may begin, for me it begins early in the morning, and that's a very beautiful time when the world is very quiet. But before I begin my day, if I could spend a few minutes, whatever is comfortable for me, whether it's 3 minutes, 10 minutes, whatever, and in those special moments which are for me sacred moments, what I'm doing is reminding myself of essential spiritual truths, that I am not the physical body, I'm not my designation, I'm not the color of my skin, I'm not all of these labels that people have attached to me. I am a being of light. I am a being of love, of truth, of joy. And as I remind myself of this reality and truth, I begin to feel that way. I begin to experience the reality of that. And that means I'm beginning my day coming out of the right side of bed, in a sense. And once I've started that journey, it can only continue, because I can come back to that feeling of the start of the day again and again. Whenever I have a moment, instead of putting things in my ears and plugging in and hearing all sorts of other things, I'll want to come back to that awareness of my own inner dignity, because it makes me feel good. It's good for me and it makes me feel good, and it's definitely going to bring about change. So the starting point, how can I trust myself when I know myself? And knowing myself happens when I give time to myself. If I'm not willing to give time to myself, how can I know myself and how can I trust myself? So going on that inner journey in silence to know myself, connecting with who I am, learning that I'm a spiritual being, and connecting with the inner being, I see value for myself, respect for myself, trust myself, and I have dignity. And I'm able then to treat others with dignity also. Without my inner self-respect, I cannot treat anyone else with dignity.
So we're being called for spiritual solutions, inner work, paying attention to our thoughts, our words, our actions, like the doctor said earlier. We're in a particular time that we need to solve ourselves deeply and spiritually. We need to pay attention to our hearts, our souls, and each other. We need to care about other people more than we just care about our desires being fulfilled. So I would like to invite all of you, please, every day, could you just dedicate 1 minute, just 1 minute a day, 60 seconds, to sending your good wishes and pure feelings to our healthcare providers? We might not be able to give money. Maybe we can't give scarves or ventilators. But your good wish and your blessing for just 1 minute a day will help them through these very challenging times. So I'm going to close the show with showing you how to wash your hands. If you don't know by now how to actually wash your hands, I think you're going to love this. Thank you so much for joining us at 6:30 to 7:30. I know this was a really intimate and somber session, but it was important for us to really, really extend our pure feelings for this particular sector of our society. It is so needed right now. And again, what I'm hearing from everyone, leaders and friends and folks in the field, we haven't even seen anything in terms of the numbers of these cases. And so we want to make you feel stronger mentally, physically, emotionally. So as the doctor said, the more loving and caring and kind you are, the more you build your immune system. So let's activate that. And here is how you wash your hands. Anyway, take care and see you again tomorrow at 6:30. Thanks for joining us.